really drawn to looking at the patient as a whole. And I began to see and appreciate the value of focusing on the person, not just the disease, looking to the person holistically. And that is really the essence of palliative care, holistic care that focuses on improving the quality of life of the. I'm Dr. Caryn Khoo, a Palliative Medicine Consultant here at Sunway Medical Centre. So what is palliative care? Palliative care is really specialized medical care that focuses on improving the quality of life of people with serious illnesses like cancer and organ failures. The goal of palliative care is really to improve quality of life by effectively treating symptoms like pain or breathlessness or nausea, as well as providing psychosocial and spiritual support to the patients and family members. Anyone with a life-limiting condition qualifies for palliative care. I think especially if they have uncontrolled and distressing symptoms. Now, since the focus of palliative care is about improving quality of life and effectively managing symptoms, an early referral to palliative care services actually benefits the patient, and certainly not, only in the final stages of disease or if the patient is dying, because effective management of symptoms also ensures that the patients are that much more able to continue the treatment of their underlying diseases. Our team here, our palliative care team, is composed of specialists, palliative care physicians, medical officers, nurses, and we work closely with the patient's primary consultants like the oncologists, chest physicians, nephrologists, or cardiologists, as well as allied healthcare members like physiotherapists, occupational therapists, dietitians, clinical psychologists, to craft a patient-centered management plan. So I think everyone is different, and they may have very specific and individualized needs, and the palliative care approach is really quite holistic. Patients with serious illnesses like cancer often have symptoms such as pain, nausea, breathlessness, that may be from the underlying disease or sometimes even from the treatment like chemotherapy. Effective management of these symptoms really depend on the underlying cause. So we need to actually accurately diagnose and try to address these underlying causes. Pain especially is a very subjective experience, and it may differ from patient to patient. The concept of total pain described by Dave Cecily Saunders really refers to the experience of suffering encompassing the physical, psychological, social, and spiritual domains. So the palliative care approach is for a patient in pain is really to try to identify what the issues in each of those domains and trying to address these. Palliative care practitioners view the patients and their family members or significant others as the recipients of care. And you can understand when a person is given a diagnosis, a scary diagnosis like cancer, oftentimes there is a lot of psychological distress, fears, anxieties about the uncertainties, about the diagnosis, about the prognosis. So each situation is different, and depending on specific needs, we may support them by active, compassionate listening, addressing some of the medical concerns that may arise, and advanced care planning, which is really to help them understand about their disease, the expected cause, and help them plan for the future. This may also include educating the patients and their caregivers about how to manage symptoms, especially if they are at home, and what they can do. We often also assist them in navigating difficult medical decisions and helping them align these decisions with what matters to them, their goals of care. Because oftentimes, in the world of medicine, the doctors speak in almost a different language. People who may not have medical training may not fully understand what is being said to them, the consequences, and what to expect. So in palliative care, we take the time to help them come to an understanding of this. I think there is still considerable stigma with regards to palliative care, with many equating palliative care to death and dying. We still do see late referrals to the service, sometimes when patients are close to die, even hours or short days before death. And this means that the patients may have gone through a period of suffering, physical pain, other symptoms before seeking palliative care. And although we are able to most of the time quickly address and manage these physical symptoms so that they are comfortable, but the late involvement of palliative care also means that we have lost the opportunity to actually support patients and family members in all the ways mentioned earlier. One way to reduce this stigma, I think, is through continuous palliative care advocacy work, such as this interview that we are doing, help people understand what is palliative care and how we can help patients. Locally, we have also recently did our second Sunway Virtual Palliative Care and Oncology Symposium, targeting the healthcare professionals. This was very well received with an overwhelming response from participants and the Asia Pacific region and beyond. There is a lot of palliative care research going on internationally, with I think the emphasis now on quality measures and patient-reported outcomes, since after all, palliative care is really patient-centered care. However, in Malaysia, I think a lot of the work is related to service development at this point. Our first national palliative care policy and strategic plan was launched by our health minister back in 2019 as a result of collaboration between the Ministry of Health as well as various stakeholders and experts in the field, public and private sectors. This publication identified issues and gaps in palliative care and provided recommendations as well as strategies for the development of palliative care for the next 10 years, with the overall aim of sustainable and equitable access to quality palliative care for all in Malaysia. Last year, the Malaysian National Institutes of Health team, in collaboration with palliative care clinicians, also published their work on projected palliative care needs in Malaysia. And what they found is that palliative care needs are expected to steadily increase, with 240% growth by 2030 back to 2014, with the highest needs expected among the older age group, in line with an overall aging population. The 5 states that are the top states with highest needs are expected to be Sarawak, Perak, Johor, Selangor, and Kedah. There's a saying, to cure sometimes, to relieve, to comfort others, which I hold dear to my heart. I think in medicine, despite amazing advancements, there are still many serious illnesses that cannot be cured, especially in the advanced stages. But yet, there is still so much we can do for patients. Pain relief is the number one priority expressed by patients with life-limiting illness, and that is really something that is paramount in palliative care. That is our focus. Palliative care physicians are experts in the management of pain and other symptoms. And though we cannot alter or prevent the natural cause of serious illness like cancer, we can still work together to ensure that there is optimal management of symptoms for the patients, so that they can still live the best life that they can in the time that it needs. Supporting the patients and their family members on this journey is highly rewarding. I have certainly learned so much from my patients. Deep love, grace, courage, humility, compassion, forgiveness, facets of life that serves as a reminder of shared humanity.